The EMS Performance Improvement Center is affiliated with the Department of Emergency Medicine at the University of North Carolina, Chapel Hill. The idea is to collect EMS incident data and analyze that data for the use of performance improvement in the EMS community. We serve 3 states, North Carolina, South Carolina, and West Virginia. We have an outreach staff that travels to EMS agencies, travels to the system offices, and works with the EMS professionals to kind of go over and analyze their data and get them to understand where their weaknesses are and where their strengths are. One of the big issues in our data collection is data quality. So we work with EMS professionals, with the organizations, to train them how to give us good data and how to recognize whether the data they're giving us is quality data or not.
EMS has to be able to monitor its performance so it knows what quality of care it's providing. And if it knows the level it's at, it can compare its level of performance to other counties and other agencies, and it can benchmark itself and know how to improve its care.
We have fairly substantial reports called Toolkits that analyze the data on a system level in North Carolina and on an agency level in South Carolina and West Virginia. The Toolkits essentially aggregate the data, compare an agency or a system against systems or agencies of similar size, similar demographics, and then against the state. We've got the System Response Toolkit, we've got cardiac, acute cardiac, stroke, trauma, and pediatric toolkits. And each of them cover specific aspects of EMS data.
The toolkits offered by the EMSPIC help benchmark the care given by county EMS agencies on certain specific disease entities. And they can then find out where they are relative to other counties and focus on trends and individual providers to improve their care.
CIS is the credentialing information system. It tracks agencies and agency rosters, agency licenses, agency vehicles.
The biggest addition that we've gotten from the CIS system is the ability to trend and track all of our resources in the state and from one central location. We use it to see different data such as who's on rosters, what kind of attrition rates we have in and out of the state. Also use it for certification purposes, which has actually alleviated a lot of time in our training and certification division. Since we've implemented CIS now, we've actually tripled our enforcement actions in the state of South Carolina.
PREMIS is the Pre-Hospital Medical Information System. It's a database that tracks every EMS event in the states of North Carolina, South Carolina, and West Virginia. It tracks a comprehensive list of parameters. The data is supposed to be uploaded nightly.
We link PREMIS to a whole host of databases, so we can actually follow a patient from the time that they call 911 to the time that they're discharged from the hospital. So we can actually get that continuum of care and know where EMS was effective, where maybe they weren't effective, and where care could have been improved.
We use the PREMIS system to help out with various other state agencies such as Medicare, Medicaid, the Office of Inspector General, U.S. Attorney's Office for Medicare and Medicaid fraud. Oftentimes you'll see providers falsifying run reports, falsifying different aspects of paperwork, and with the real-time data that CIS provides us and that PREMIS provides us, we have instant access to verify this information before we turn it over to other state agencies.
SMART is the State Medical Asset Resource Tracking Tool. It's an application that was written specifically for mass casualty disasters. One of the mysteries of life is, do they have the number of beds? Do we have the number of this number of doses of this medication? And with SMART, it allows us to track that information.
Emergency preparedness for emergency medical services personnel is really important because, as an example, last week in West Virginia, we had a state emergency. And we had 2/3 of the state without power because of our ability to have been prepared through using the SMART system. With the EMS agencies in particular, we knew what assets were available across the state.
In a recent hurricane disaster drill that we've done in South Carolina, the SMART system in conjunction with CIS proved invaluable in that we had real-time information about things like bed capacity, which in the past has not been available to us.
At the EMS Performance Improvement Center, we take the lead in grant writing and in providing data to make the case that funding our initiatives are worthwhile and funding the EMS agencies who will be eventually taking care of the patients with the funds that are provided, be it federal, local, or state. We give them data to prove their case, and then we assist them with delivering final reports to show that the grants and the funds were used appropriately and made a huge impact.
Working with the EMSPIC, we have been able to get markedly increased grant funding for projects like Lead the Wave, which have allowed us to place continuous capnography monitors and 12 lead machines in EMS units across the state, which are in rural counties with limited financial backing, which is dramatically improving the quality of care we can give to patients in North Carolina.
We're a small shop at the EMS Performance Improvement Center, but we're an organization that gets it. We actually understand that the information we collect and the data that we give back can actually help improve lives and make patients safer when they call EMS.
Working with the EMSPIC has definitely benefited patient outcomes because we can see things not at an individual county level, but on a broad statewide level, which has allowed EMS care in North Carolina to progress markedly.